Order the meeting. I'd like to call to order the Board of County Commissioner with the Emergency Operations Center at our temporary home. Would you please join me in the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. We have some time for public comment. Anybody in the public want to speak? If it's on a non-agenda item.
It's regarding COVID statistics.
Sorry.
It's regarding the health department and COVID statistics.
Okay. Go ahead.
Okay. My name is Mary Baker. My husband Luke and I have lived in Atchison County for most of the last 23 years. We have 4 children. The oldest one is homeschooled. The next 2 boys attend St. Benedict's, and the youngest, who's considered medically complex and fragile, is enrolled in the special ed classes at Atchison Elementary School. I feel that our children have gifted us the opportunity to be part of several sub-communities within Atchison County, rather than keeping us in one circle. While it seems our entire nation has been divided over several issues concerning COVID, I have noticed in conversations the growing disparity between how people perceive the COVID situation here locally. I feel that the health department's decision to stop posting regular statistics regarding active cases and hospitalizations play a large part in this. I conducted a 9-question survey to see 1, how others are perceiving our current local situation, and 2, whether or not people were satisfied with the amount of accessibility of information they were receiving. I had over 170 responses in just a couple of days. I do have copies of the actual survey reports, and I'm going to be sharing those findings on the same forums, the Atchison chat page on Facebook, and some local emailing groups where I placed the survey to begin with. But I would like to run through the more salient points today. First, let me say I am not a statistician of any kind, and I don't claim to be. In December, I had the very rare opportunity to sit by my father's bedside as he passed away from COVID, and I've seen firsthand the effects that this virus can have on a person's body and what kind of death they die from it. As Patsy's mom, my days are filled with seemingly small decisions that dramatically impact the well-being and life expectancy of my daughter. And I have to weigh those decisions with the mental, physical, and emotional well-being of my 3 sons. As such, I'm probably more attentive to the local situation than many, but I know that loving someone fragile is not a unique situation to be in. As for the survey, please note that I'll round the statistics as I speak here to the closest percentage, but the actual, more detailed numbers are here in the report. I asked, do you work in the medical field, and do you have a medically vulnerable person in your household or extended household? These questions were designed to give insight into who was taking the survey and how it would impact their answers later. One can assume that those in the medical field would have a better understanding of the actual situation, and those with medically vulnerable people have a higher stake in the game, so to speak. 20% of those who answered do work in the medical field, and 55% have a medically vulnerable person in their households. When asked how satisfied people are at their ability to find the local COVID statistics, 48% were unsatisfied, 22% were satisfied, and the rest remained neutral. When asked whether they believe the situation has improved since this time last year, 53% answered that it had gotten worse, and 47% answered that it has gotten better. When asked if they had to guess how many active COVID cases Atchison County had from August 21st to the 23rd, the answers varied greatly. It really showed the spread of understanding. 14% said that we had less than 30 cases, 19% said 30 to 60, 18% said 60 to 90, 17% said 90 to 120, and 31% said more than 120. I have no idea what the correct answer is. Only the health department and the officials they are working with know that right now. I created this survey to understand perception and improve my hunch. People have no clear idea what is happening locally and are not satisfied with their ability to find facts. I'm aware that the numbers are posted on the KDHE website, but it only shows total numbers, not active cases. And if you're not a statistician and if you're not following the website religiously and doing the math, it doesn't help people understand what the current situation is from week to week. 88% of people want to see the Atchison County Health Department posting statistics such as active cases, age ranges, and hospitalizations weekly at the very least. Some of them sent daily. The last time that I was able to find any direct information was on the Northeast Kansas Multi-County Health Department Atchison County Facebook page on August 4th. I believe at that time we had 120 active cases, but when I went back to double check that information this morning, I was unable to bring the page up. Perhaps it was a Facebook glitch, perhaps the page has been taken down. I couldn't find it, and I don't know. But without facts to base our decisions on, my family plays it very safe, while others act as though there isn't a pandemic at all. Maybe they are right, and my sons are free to participate more fully in the community right now without putting their sister's life at greater risk. I would love it if that's the case. I hope that's the case. But maybe I'm correct in assuming the worst, and others need to be more aware of the risks that they're taking. The long and the short of it is this, folks. If you want the residents of Atchison County to make safe, informed decisions, you have to inform them. The health department must go back to posting information at least weekly. If the problem is manpower, I'm here now offering to volunteer myself to help make that a possibility. If they're gathering this information anyways, I would be happy to help make that available to the public. And I mean this offer. I've spoken with others also who would be willing to volunteer their time to help with other things such as contact tracing, which of course is a huge job at the moment. If the health department is truly too overwhelmed to properly usher our community through this crisis, as is their purpose, then we need to rally together to help them. Going through strong leadership and open communication, that this community will be able to see the clear reality of this pandemic, be it better or worse than any of us imagined. Thank you.
I'll let you know today at our workshop.
What was that?
Today at our workshop, we discussed that we want to have a weekly update.
Oh, perfect. Okay.
And I don't know if you know it, but the New York Times has a great website that gives Atchison County numbers.
I did not know that.
So it's
Yeah.
I mean, for your personal, I
Yes,
don't think
no.
that's practical for everybody.
No, I don't think so either. But anyways, I have just 3 copies. Ignore the question numbers. That was my editing issues, but these are the only questions asked. There's 9 of them. These are the order they were asked in. And the way I designed it, it was supposed to shut people off after the first question, are you an Atchison County resident? If they said no, the survey was supposed to end there. So it should have only been Atchison County residents that answered. Thank you very much for taking the time to listen.
I would like to piggyback on that and saying that I really can't comment on, so Mary Baker is my sister-in-law, but outside of her presentation today, I have had many community residents contact me with concerns on the amount of information that we are getting at Atchison County level. And I did find it, I took a screenshot of the Northeast Kansas Health Department website. Christina Romine did say she had limited staff and cannot keep up with posting the numbers weekly. Again, as a new commissioner, I don't know all the inner workings of Northeast Kansas Multi-Health, but I thought that that was one of the things of a benefit of being in a multi-health setup is the fact that staffing and more resources to help. And so
We
I
are
guess
currently down a nurse at our office here, so,
in Atchison.
yeah,
Okay.
so
Well-
that's part, and that's kind of coincides with the dates of the last posting is about that approximately the same time as that person was no longer there, so.
I've also read Facebook posts about them getting cussed at, and I know the frustration in the county is high. And just how do we get that down to their level where they feel appreciated? I have a hard time with that when we're in the multi-county because we don't have that connection with them like we do our county departments. If Wes is struggling, we're here to support him. I feel bad for their nurses that are working there all the time. I just feel like it's been a failure from the leadership at our facility. And the fact, again, this is just me, my commissioner input is the fact that we've asked since I've been here since January for her to come before us, give community updates. We have asked that and we have yet to see that. And as a leader of a facility in a crisis, I understand stresses, but you have to take ownership in that. And if the organization is, the perception of the organization and the acceptance from the county is not is not acceptable. I mean, maybe we need to be looking at the leadership level, because again, you can only do so much as your leader.
But to be fair, a lot of this is due to the KDHE taking over the reporting and the contact tracing and things like that. So things that were happening at one point stopped from above them. So there's multi layers of where facts lay and how they are given to us. So things that happened in the past not necessarily are still happening because of things out of our control.
Well, and again, so if that's the case, even if she comes to our meetings and gets on there and explains, like, these things are out of our control, and this is why, we're educated to where when somebody stops you on the streets and says, what's the COVID numbers? I have no clue. I haven't heard from her. Like, it's the leadership that's representing the organization, not necessarily the people doing the job. And at the end of the day, we just want what's best for Atchison County and the residents. So let's listen to the people and try to have some conversations. Maybe you'll have better pull with her than I do. I mean, we've asked, and we have yet to get anywhere. And I know there for a while she was saying, the feedback we were getting was based on Wes, and it's like, it's not Wes's job to update the public. It's the county health department's job. And again, to your point, it's just communication. If we have the communication, maybe everybody will see things differently and have a little less anger. I mean, because everyone's stressed out. COVID is not fun and affecting everybody's families differently. And everybody's anxieties are high, and school's starting, and masks are, being implemented. And it's a lot of emotion. So I just think we need more from the leadership there. That's just based on the constituent text messages and feedback that I've gotten outside of Mary's research and survey she presented today.
Anybody else? Anybody online? Okay, moving on. Have you had a chance to read the minutes from last Tuesday's meeting?
I have. I'll make a motion, we accept as written.
I'll second.
So moved and seconded. All those in favor signify by saying aye.
Aye.
Okay, on 8/18, there was a special meeting of the Atchison County meeting. It. Chair would entertain a motion to approve these minutes.
I'll make a motion to adopt.
I'll second.
All in favor signify by saying aye.
Aye.
I'll abstain, because I wasn't there. So, okay, commissioner comments and committee reports.
My thought today is that now that Pfizer has approved their vaccine, I know that people have had problems with accepting a vaccine that was on a temporary basis or emergency use basis. So I think any of those people that were using that as a reasoning or unsure of whether to get it, I would encourage them to look into the Pfizer vaccine. And I think shortly it will be, Moderna will be in a couple of weeks that they will apply and be granted that status. So please consider getting the vaccine when it's approved.
Yep. So last Wednesday, I took part in a special meeting with Eric and a new healthcare that we contracted with for Senior Village. And we've had nothing but positive feedback so far. A couple constituents did reach out to us with questions and just wanting a better understanding of why we made the decision we did, which I'm looking forward to meeting with them later this week to sit down and have a cup of coffee and chat about that. But overall, we just needed help in so many areas that this management group will help us stabilize the facility and let our nurses get back to doing what they love, which is taking care of our residents. and not some of the other added stresses that have come along with COVID and just today in general. I had a joint communications board meeting last Wednesday, and that was good. It started a lot of conversations about the future of the center and where we head from here. Economic EDAG, I was appointed as an ex officio member to the EDAG group, which was exciting because I love economic development in Atchison County and just staying up on what's going on there. And then also, Eric and I, we attended the Fair Board meeting last Wednesday evening and just sat there and listened to the Fair Board and the extension agents recap the 2021 Atchison County Fair. So that was very interesting, and I learned a lot on that. Thursday, we had an all-staff meeting for Senior Village that we were able to explain to the staff what was happening before it hit the papers, and everyone was very supportive. It boosts morale with the staff, so that was good. And then Friday, I volunteered for Project Atchison at the Fox Theater, helping Benedictine students attended and watched the movie Footsteps. And then also they headed out into Atchison to do a cleanup day. So that was really cool to participate in that and see the students get back and get to work. So that is all I have.
K.S.A. go more involved.
Hi. Yes, sorry, I had to get myself off mute.
Okay.
I'm sorry, did you ask me a question that I didn't hear, or you were just seeing if I was present?
We're overlooking the document.
Okay.
Thank you for the quick turnaround time on that. That
You're
was
welcome.
awesome.
I wasn't sure if you had access to email and could get that quickly, but I thought I better send it on the off chance that you could. So
Yeah, no, thank you.
you're welcome.
So this is a resolution authorizing Atchison County Commission, its educational facilities revenue bonds, Benedictine College project. So it's 2021 for the purpose of financing a project of Benedictine College, authorizing and approving the execution of certain documents in connection with the issuance of the bonds and authorizing other actions in connection with issuance of said bonds. The bonds are for $7,200,000. And they will sell the bonds not to exceed $7.2 million. So the chair would entertain a motion to have the chair approve a signed resolution 2021-1485.
So moved.
Moved by Commissioner Quinn, second by Commissioner Knoll. Discussion. All in favor, signify by saying aye.
Aye.
Passes.
The only thing I would say is just that we had changed the amount from our original meeting and lowered it down to the 7.2 million at this moment. So
Could I just add something?
Sure. So the actual amount of the project has changed. I think two issues came up today. One, we didn't realize that the county was asking for authorization of 1.7 $1,750,000 for developer. So we asked for more. So this is kind of an attempt to lower it back down. The other thing is we have an issue with on the St. Benedict's County wanting to be at a certain level amount each year for that. So without getting into all the details, I mean, they were going to have to go to that and get approval for this bond issue. So by lowering it down to $7.2 million, it gets it below that threshold. And we've had an approval. We will come back to the county for next calendar year to do part of the
thanks for saying that, because the public that might be listening, watching the recording will be aware of that. Thank you.
I appreciate the quick response as well.
So Patrick, do you want this or should I give it to the clerk? Okay.
Well,
Deputy clerk has to
yeah,
suggest it.
the deputy clerk needs to attest, and then do you want to take photocopies with you, or should they just be scanned?
You know, let's ask Gracie.
Is it, I think, is it Kathy or Linda?
It's Linda, is that?
I think, Linda, if you can just scan a copy after the meeting at your convenience and email that to me, that'd be perfect.
All right.
And then we can take care of getting that published also.
Thank you.
Thank you.
This is Shelley Nelson, Community Correction Supervisor. Want to present, Shelley?
Can you hear me?
Yeah.
Yes.
I cannot get my video to work, so. I just wanted to seeking approval for the carryover reimbursement budget for both the adult and juvenile programs. I had sent this out a couple of weeks ago. I budgeted $205,697.74 on the adult side, $46,302.53 on the juvenile. This money comes from doing bond supervision fees for AISP, and doing UAs for other agencies. This money has been collected for several years. We do have to budget the money. It's not expected that we spend it, but it does have to be budgeted. It's in various different line items. If you like, I could go through it.
I don't think it's necessary.
Okay.
So the chair would call for a motion to allow the chairman to sign carryover reimbursement plan and budget summary and budgeted narrative. I have a motion.
Also move.
I'll second.
Any further discussion? Hearing none, I assume you're ready to vote. All in favor, signify by saying aye.
Aye.
Passes 3-0.
Thank you.
Shelley.
Thank you.
Is there just one, or is there one adult, one?
Yeah, there's two.
Yeah.
I won't miss it this time, Eric. Okay. Wes Lander, you want to present purchase order for servers?
Yes, and before you, I have a purchase order to replace our 2 virtual hosts, which host all of our virtual servers for the county. The servers that we have in place were put into place in 2014, and this is just a replacement plan. So for the 2 servers, it's a figure of $10,066.08 to purchase the servers. Then we'll have installation, programming, migration, and licensing of those servers for $7,642, for a total of $17,708.08. And that's with Converge One out of Capital.
So that maintenance, or did you say
Licensing and
license? Is that a one-time deal, or is that yearly?
So this will cover us for 5 years, actually, and then if we keep the servers longer than 5 years, which typically we would never do, but we did this year due to COVID and everything. So typically at 5 years, we would be replacing those servers. Okay, so it's one time for these.
Okay, yeah, the fee for that,
Yes.
but one time of 5 years, 5-year term. Okay.
Okay, the chair would entertain a motion to approve Converge One for a total of $17,708.08.
So moved.
It's moved by Commissioner Quinn,
Second.
seconded by Commissioner Knoll. All in favor, signify by saying aye.
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 Passes 3-0. Atchison Chamber of Commerce membership dues approval. Chair would entertain a motion to approve $225 for 2021 Membership dues.
So moved.
Second.
All in favor signify by saying aye.
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 Passes 3-0. We have 5 minutes before our revenue neutral rate meeting begins. Do you want to take a recess for 5 minutes?
Yeah.
Sure.
Recess. We're back from recess. I'd like to open the revenue neutral rate hearing. We have any questions? I'd like to close the hearing on the revenue neutral rate. I'd like to open a public hearing on our 2022 budget. It's an opportunity for people who have any questions, concerns. Hearing none, I'd like to close the public hearing. The chair will entertain a motion to approve the 2022 budget as presented.
So moved.
Moved by Commissioner Quinn, second by Commissioner Knoll. All in favor signify by saying aye.
Aye.
My computer. Older unfinished business before the board. County council updates. I don't have anything to add today. Okay. This is the time reserved for public comment on non-agenda items. Does anybody have any comments? Seeing none, chair will entertain a motion to adjourn at 1:32 p.m.
So move.
Second.
All in favor signify by saying aye.
Aye.
Let's